Thank you, Chairman. Thank you, members of the committee. Thank you for the opportunity to discuss with you today the epidemic of childhood obesity. This is clearly a problem in America, as stated in our own National Scorecard on U.S. health system performance in 2011. As we could see here, nearly 1/3 of our children aged 10 to 17 were overweight or obese as of 2007, and with rates ranging from 24% to 39% among the top and bottom 5 states. The most alarming thing about this epidemic is, unless there is an improvement in healthy eating and weight control, obesity and related health problems are likely to rise and could wipe out the recent gains that we got from declining smoking rates. According to the State of Childhood Obesity, which is a project funded by the Robert Wood Johnson Foundation, we have had many policies in place, all aiming at childhood nutrition and physical activity. Some of them I will highlight as helpful or not helpful for our course here. The Supplemental Nutrition Assistance Program, also called SNAP, provide approximately 40 million Americans with food each month. However, this program does not differentiate whether those people are buying healthy food or unhealthy food. As opposed to the WIC program, Women, Infants, and Children, in 2009, the WIC food package was updated to include more fruits, vegetables, whole grains, and lower fat milk. Research shows that this change results in positive changes in childhood obesity. Similar to the SNAP program, the Child and Adult Care Food Program also has not made any positive contribution to the childhood obesity epidemic. The School Meal and Snack Program provide more than 29 million children in America with lunch and 15 million with breakfast at school. This program should, according to the website here, should have helped the childhood obesity epidemic. However, from what I've seen, children at my school, one of my schools I used to work at, and what they had for breakfast in school, it is just not healthy. It was packaged food, high fat, high saturated fat, and high calories with low nutritional content. One of the things I would like to highlight here is the food marketing to children. We see that in 2016, kids and teens saw an average of 10 to 12 ads per day on television for these for unhealthy food products. And after seeing these ads for unhealthy food and beverages, kids are more likely to choose those products. And unfortunately, these ads really focus on poorer area and target Black American and Hispanic American disproportionately. So how do we measure childhood obesity? We measure according to the BMI that was calculated based on parents' reported height and weight. And as we all know, overweight is defined as a BMI between 85th and 94th percentile of the CDC growth chart, and obesity is defined as 95th percentile and above. We do see an upward trend here in children who are overweight or obese between the ages of 10 and 17, and the trend went up from 2003 to 2007. Again, this epidemic is disproportionately affecting Black American and Hispanic American, and it's also disproportionately affect children of poor family. So children of family that are at or below poverty line is twice as likely to be obese or overweight comparing to children of family who makes 400% or more of the poverty line. Children also are more likely to be obese or overweight if they are uninsured, which means they have less access to healthcare and perhaps have parents who are less likely to be educated and able to secure a good job with private health insurance. So how can policy help fix this issue that we are facing in America? First of all, let's examine this article by Milbank. They have done this research, and they found one of their findings is competitive food, such as food sold out, which are foods that sold outside of federally reimbursed school meals, and this really means foods in a vending machine or foods sold in a fundraiser, are widely available in schools, especially secondary schools. And studies have related the availability of snacks and drinks sold in schools to students' high intake of total calories, soft drinks, total fat and saturated fat, and lower intake of fruits and vegetables. The study goes on to conclude that stronger policy are needed to provide healthier meals to students in school, and this is what we need to pay attention to: limit their access to low nutrient, energy dense foods during school days, and of course increase the frequency, intensity, and duration of physical activity at school. So how do we limit their access to low nutrient, energy dense foods during the school day? The Harvard T.H. Chan School of Public Health has several recommendations that they have put out on their website, on their page on obesity prevention. There are some policy here that they have compiled a list of, and we will scroll down to the list that has to do with competitive food in school. So foods sold or served outside of school meals, as we know, are called competitive food. And when Boston banned sugary drinks sale in public school in 2004, a study from Harvard School of Public Health finds that after the ban, city students cut back on sugary drink consumption. So the ban helps students to make healthier choices outside of school. Just because they didn't get sugary drink in school doesn't mean that they will go out of their way to the grocery store or convenience store or order it in a restaurant to make back for the sugary drinks that they didn't get. And so these are the policies that that are recommended here from the T.H. Chan Public Health School. First of all, we should ensure competitive foods meet healthy nutritional standards that are consistent with those of the school meal program. So that in order to do this, I believe that we need to put a ban on sugary drinks vending machine as well as junk food vending machines in school. And that goes with the second item: eliminate sugar-sweetened beverages in school environment. And the third item they mention here is ensure that food served in classroom parties and school functions, including fundraiser, meet competitive food standards. What does that mean? So in elementary school, students are usually allowed to celebrate each other's birthday in the classroom. And the parents would bring in unhealthy food, usually like Oreos and cupcakes, to do so. So if there's a class of about 24 students, that is pretty much guaranteed a twice a month opportunity for students to celebrate their friend's birthday with unhealthy food. So now they're going to associate unhealthy food, which already make them feel really good, with a happy occasion, which is celebrating a friend's birthday. So it is extremely important that we also attack this epidemic in the sense of birthday parties, fundraisers, so that we may eliminate sugary nutritional values food in school. So I am asking the committee to create a general policy at the federal level to push for healthier food environment in the pre-K to 12 schools, private and public, and providing money for the states to create, enforce, and monitoring the specificity of these policies. So from the 3 recommendations by the T.H. Chan School of Public Health, I would like to propose a ban on junk food and sugary beverages in vending machine and school-related activities. The vending machine in schools. Perhaps they can be converted to vending healthy foods, and cupcakes and Oreos for birthday party can be fruits instead. I would like to propose random inspections of school-provided meals for nutritional values, because the reality of me seeing what the students are eating and why it's chicken nuggets are very appetizing to me as well as to the students. It is not a healthy food if the student gets that almost every day. It is drenched in oil, and the breading it soaks up even more oil. Thank you very much for listening to my presentation. Thank you, Mr. Chairman. Thank you, committee members. I hope you consider my proposal, and please, I yield the rest of my time for any questions.